The last few weeks have taught us all new ways of living, of course, adopting social distancing, regular hand washing to minimise the risk of infection. But our hospitals have also faced major changes to keep patients safe. And for the third of her exclusive reports from inside the Royal Blackburn Hospital, our health correspondent Gill Dummigan went into the A&E department.
Right from the front door, A&E these days is very different.
When they book in at reception, we ask them what their symptoms are. We check about having a temperature and about a cough, shortness of breath, sore throat, etc.
Perfect, thank you very much.
Quite often we've got people coming with an injury and they concurrently have signs and symptoms of COVID.
Patients showing no symptoms are treated in an area now known as the green zone.
But if people are showing signs of COVID-19, then they end up here, the red zone.
Emma Hall was told by her GP to come after her symptoms got worse.
I keep getting breathless, and since last night I'm breathless again, unable to take a full deep breath, pain in my shoulder blade and like a heavy feeling, like I've got like a bowling ball in my back.
Is that quite frightening?
Yes. Yeah.
So what's happening now? Do you know what's happening?
No, I've just had my obs taken, which seemed to be okay, and just waiting now to find out what next steps are.
Around 50% of the patients currently coming to A&E show symptoms of the virus, meaning the departments had to put extra measures in place for infection control.
When a patient who's possibly got COVID leaves a room, we have to then leave the room empty for 20 minutes and then it has to be terminally cleaned, which takes 20 minutes to half an hour. And you can imagine when we've got patients waiting to come in, then we need all those rooms. So we've had teams of cleaners who are based in the department to turn the rooms round as quickly as we possibly can.
It's not just here. The entire hospital's now been divided into red and green zones, meaning dozens of wards have had to be moved or repurposed.
B18 is our cardiology ward. That is now a critical care ward. Ward B20 was a medical ward. That's now been repurposed as a critical care ward. And wards B24 and B22 are now part of our medical assessment ward.
People must have been working around the clock for that.
They're working incredibly hard.
Stopping the spread of infection takes a huge effort. This critical care patient's being moved from a ward on one side of the corridor to the other, so everyone else has to stay back.
We've got to close the corridor and now the nurses are just coming back.
So you shut the whole corridor down to do that?
Yeah.
Why have you done that?
We've done that so that people can't walk down the corridor and come in contact with nurses that might have a heavy viral load on them because they're working in the COVID area. So we close the corridor down, we make sure that there's no dispersal of the virus at all, so the patient hasn't sneezed or there's been no aerosol generating procedure. And then as soon as we're sure of that, which I am, then the nurses come back out from taking the patient and we can open the doors and open the corridor again.
And social distancing rules mean far fewer patients can be accommodated.
We have to have a reduced bed base. That is in keeping with patients separate at a reasonable distance and also to manage the surge. So hospital currently is running at a bed capacity of anything between 50 to 60%.
Meanwhile, the changes in A&E mean the minor injuries units moved down the corridor, with some staff having to work in both.
It is quite a distance for them to go, so they could be down here dealing with an issue or patient query and be needed at the other side at the same time.
So do you find that you're sort of dashing between one site and the other, trying to...
Yeah, there is a lot of that, a lot of going to and fro to different areas.
And there's another issue. Over the past few weeks, the number of people turning up at A&E has fallen dramatically.
Normally our average daily attendance is about 500 patients a day and we're down at about 250 to 300 a day. A proportion of those will be patients who had chest pain, signs and symptoms of stroke, abdominal pain, and those patients, we need those to come here, and there is a worry that they're staying at home because they're frightened.
The concern is that doctors may be missing the chance to spot potentially life-threatening conditions.
In the long term, people will get far more complications of not having the disease attended to in a timely manner. Hospital is a safe place, so please don't stay at home if you have an emergency that really needs to be attended to.
Gill Dummigan, BBC North West Tonight, Blackburn.